This is Late Night Health. I'm Mark Alyn. Dr. Paul Corona joins us for our Healing the Mind and Body segment. Dr. Paul is the author of Healing the Mind and Body trilogy. And we're going to talk today. We're surprising Dr. Paul. He said, you pick a topic. I want to talk about addiction because I think addiction actually relates to what we talked about a week or so ago. And that is that people deny that they have a problem. They don't want to talk about, mental issues. And yet at the same time, they may need some help. And it just somehow dovetails into addiction. Am I right? Is that all combined together?
That's absolutely right. And addiction it's a little complex, but the issue with addiction really is self-medicating. And when people self-medicate with whichever substance, whether it be street drugs or or other like prescription products that are addictive, like tranquilizers and things like that, like Xanax, Valium, etc. People are self-medicating because they're trying to treat something, and it's usually they're trying to reduce their stress level, they're trying to improve their mood, and they're trying to escape, in a sense, escape from their situation, and just kind of. And people say the same with alcohol, is just trying to escape from the situation and for a moment.
And what happens is that prescription drug addiction is really blossoming. People are, they'll go to 6 doctors to get 6 different prescriptions so they have enough so they can get through their week. Right.
And the thing is that people will say that, well, if I get a prescription from a doctor, it's okay because it's prescribed. But that's the problem with the addictive substances such as Xanax, Valium, tranquilizers, sleeping pills, is they're only covering up the symptom and they're not really getting to the core issues that lead to the symptoms.
What about, let's sidestep drugs for a second. There are other kinds of addictions. Exercise addiction, sex addiction, neither one of which I personally have. But, the sex, maybe I could. Anyway, that's another story. But those are also addictive traits. Do they follow the same as drug addictions? Is it just
yeah, and they're because sometimes someone can beat the street drug, but then when they're in sobriety from those medications, then turn to other things, such as prescription medications you mentioned, like also opiates. Pain pills are a very common drug of abuse, which you can get from doctors or on the street, and the other ones I mentioned.
And I think that one of the things that's interesting to me is that celebrities, they get addicted. They go to treatment, they come out, and then they go into treatment for another kind of addiction. Is it
this is the crux of the problem, the lack of understanding about addiction, is that, like you said, you can be addicted to many things, but people will think, well, this addiction is better than that addiction. And in a sense, you're right. I mean, there's, if people get off of some of the hardcore street drugs, maybe it's not as unhealthy as the other ones, but then what happens is people switch to doing other things. Like common things would be overeating, gambling, like you mentioned, sexual addictions, shopping addiction, and people might think exercise addiction. How can you be addicted to exercise? Well, some people go a little bit overboard and spend like 3 hours a day doing it, and it just becomes another obsession, another addiction in a sense. Though they would argue that's a healthier addiction. Well, sure.
Well, but working out so much also pumps, self-made drugs, if you will, to help make you feel better.
Right. And again, if you're going to pick one, that's one. But again, if exercising too much and getting too obsessed with it can also create an imbalance in your life, and then take away from other things that might be healthier overall to have a more balanced life.
Are things like overeating and bulimia, which would be and anorexia, are these all addictive kinds of problems?
Yes, because their addiction to, we call body dysmorphia, which is a problem with body self-image, and anorexia can be an addiction, as well as bulimia, as well as eating and purging. That's another phase of the eating disorder addiction too. And also other things that people wouldn't think about. I mean, excessive tattoos and piercings, and anything like that becomes a significant focus in life that's maybe not the healthiest thing to focus on.
In those kinds of addictive personalities, are there neurochemical imbalances, hormonal imbalances that push somebody to say, well, instead of having just 12 tattoos, I want to have 70?
Right. Yes, and this is a common misconception, is that the medications I work with, which I term the psychotropic medications, are actually not addictive substances, and that's where a lot of people misunderstand. A lot of people lump together the tranquilizers and sleeping pills with the other mood stabilizing medications that actually help fix the system, and they actually help balance the person's neurochemistry.
And that balancing takes, adjusting, does it not? In other words, you could give me a pill today, and then after a week and we talk, you say, let's take a half a pill or 3/4 of a pill, adjust the medication accordingly.
Yes, and in working with patients, like I say, patients have to be a little bit patient, because it is a process to figure out, after a full evaluation, what is exactly right for that person. And what I do things very slowly and carefully, but and it takes a little bit of time. But that's where some people really misunderstand. They think that people want a quick fix. People say, I want something to work right now. I don't want to have to wait a week or two or a month. And that's one of the biggest problems I have in practice, is convincing people that this is a better, more balanced approach for their system than the other approach.
Our guest, of course, is Dr. Paul Corona. He is the author of an exciting trilogy, Healing the Mind and Body. It's a box set. There's 3 books in there. You can buy them separately, but why would you? The books are designed for both patients and healthcare practitioners, so that you can work together. That's really what these books are about. Working
Absolutely.
together. You have a problem, addiction we're talking about, so that you work with your practitioner, your doctor, to alleviate that problem, to work through that problem, and you do it as a team rather than as 2 individuals competing.
Right, and I wrote these books really. I mean, it took a while. It took 12 years to put them together, but I really wrote them because I saw such a need out there for understanding the subject. And it's really, these books are not only for doctors, but they're also for patients, for psychologists, for other health professionals, for people, naturopath, people who enjoy naturopathic products. They're really books for everybody that I've seen over the years of my practice.
Over the years, in working with people, have you worked with people who have addictive problems?
Oh yes, for years, and because addiction really, addiction doesn't stand alone, and something led to the addiction, and it's usually something, like I said before, something else under the hood that's going on, such as underlying stress, anxiety, depression, bipolar disorder, ADD, any of the things, so many things I see, as well as physical problems that I see, are all, can all be benefited potentially. Not, again, these medications only do so much. They don't do a lot. There's a lot of other things to do besides just these, but these do help in a sense to stabilize the system.
You said that people want an instant fix. I mean, we know that they want instant weight loss, right? We
Right.
all want instant wealth. You put $1 in a slot machine and you earn $1 million back. We all want that, right?
Right.
It's the same thing in healthcare?
Same thing in healthcare, and people come in, they want a quick fix because that people want results right now. And when you mention, addictive personalities, well, that's a from mild to moderate to severe, because, all of us probably, have habits that, that we wish we could change. So it's really, this is an issue that really is a pretty broad issue, but it's a very fascinating topic, and I love treating it.
Is there a success rate? I mean, addictive problems, you see ads on TV constantly, and they're throughout the country. And addictive centers, addiction clinics, if you will, the celebrity types, can be $30,000, $50,000, $60,000 a month.
Right.
And I've toured several of them. You get, you wake up and you have yoga, you have a nice breakfast, you go for massage, you have a therapy treatment. Right. You've got, all of these different, did I say massage? You sit in the steam room. I mean, it's big business. Yeah.
And that's great, but the practical problem is most people can't afford that. And most health insurances don't cover that. And so it's great if you can afford it, and it's that sounds, I wouldn't mind going there either.
No, let me book a weekend,
But practically speaking, there are other ways. That method certainly works, and these programs certainly work, but there are other solutions also besides those.
And one of those would be you in your practice and in your books. How do you, in very short right now, and then we're going to come back in a moment, how do you treat addiction differently than other doctors?
Well, I really get to know my patients and take a really good history and spend a lot of time with them to figure out what led to the addiction and what happened before that, what led to it. And so really a lot has to do with me getting as much information as possible so that I can help my patients as best I can.
So it's getting to know them and working with them to overcome the addiction.
Right. And everyone's an individual, and everyone needs. And I also work with addiction specialists. I work with rehab centers, sober living places. I work with a lot of other, and with psychologists, because addiction is not easy, because we have to really approach it from different angles.
And it would seem to me that you mentioned stress and the D word, because we don't use that anymore on this program. The D word would be, common links. So we're going to take time out. When we come back, we'll come back and spend more time with our guest, Dr. Paul Corona. By the way, if you want to reach Dr. Paul, you can. Go to his website, Dr. Paul Corona, MD. That's drpaulcoronamd.com. And you can also find him at latenighthealth.com, latenighthealth.com. Dr. Paul and I will return. Late Night Health continues.